Winnie Sanyusaruma has been living with HIV for 21 years. She was in her 20s when she applied for a job as a healthcare worker and had a blood test for HIV. When the results came back positive, her life turned upside down.
Shock was the main feeling at that time. And I thought, what do I do now? Am I going to live for a long time? Am I going to die? What is going to happen to me now?
Today, 33 million people are living with either HIV, the virus that causes AIDS, or with the disease itself. A new report, just ahead of World AIDS Day, says Africa is still the hardest hit, but it also says the number of new HIV infections is decreasing, and that, the UN says, is a sign that prevention is working. Winnie Saruma is one of nearly 80,000 people in Britain who are HIV positive. That's less than 1% of the population. But in the country of her parents, Uganda, 6% of the population is still HIV positive. Winnie says HIV in Africa won't be contained until people feel free to talk openly about it.
For us who are infected, there's still stigma. There's still a lot of people who can't come out and say, I'm HIV positive, because they worry about what the reaction will be.
In Britain, 2/5 of all new HIV cases are in the African community. Mark Thompson is from the AIDS campaign group, the Terence Higgins Trust. He helps HIV-positive people in London's African community.
I think that what we've certainly seen is that if there is stigma and discrimination, and if there is broadly stigma, people are fearful and are less willing to come forward and be tested.
He says if HIV-positive people aren't tested, they are more likely to pass on the virus to sexual partners and from mother to child. He says the stigma is especially high in African communities because of taboos surrounding sex.
So it's about trying to overcome that barrier. It's trying to work with faith leaders so they no longer think that sex is just a taboo and that HIV and AIDS is revenge from God for promiscuity.
For many years, Winnie kept her HIV status a secret from friends and family. She says she first had to come to terms with her shame about carrying the virus.
I had to look deep within me. I had to access counseling to deal with some of my fears, to deal with some of the shame that I felt at that particular time. And once, I was able to deal with that, then I was able to talk about my HIV status.
Now, Winnie raises awareness about HIV and AIDS through her work at Christian Aid, a charity based in Britain. She says now that she's confronted the stigma, she can live an open life. And she hopes she can help bring an end to the shame that has surrounded the virus for so many years.
I talk about HIV publicly. I live with it the best way I know how. I share my experiences with people, and I try to help others in my situation and to help educate others about HIV.
With millions of HIV-positive people taking antiretroviral drugs, AIDS no longer has to be a death warrant. But with less than half of HIV-positive people in Africa receiving the treatment they need, experts say prevention is the key to fighting the HIV epidemic. Dr. Ede Fakoya is a physician and advisor at the International HIV/AIDS Alliance.
Prevention always gets less of a deal than treatment, and that's a shame, because for every 5 new infections, we're only able to get 2 on treatment, so we clearly have to focus on prevention.
But prevention is a low priority in many countries dealing with the disease. With HIV and AIDS still spreading, health experts say prevention is a complex challenge that lies ahead. Selah Hennessy for VOA News, London.